Welcome back to The Health Perspective. I'm Dr. Daniel Gordon, and in today's video, we're talking about milk allergy in babies, something that can be surprisingly difficult to diagnose and navigate. So, new parents, this one is for you, because it's challenging to know whether a baby's fussiness, reflux, or digestive issues stem from a cow's milk allergy, or if they are simply normal patterns of baby behavior. And I'm a doctor with considerable experience in pediatric care, and I've seen my fair share of children with milk allergies, but I've also lived it personally as a parent of a child who was diagnosed with one. So in this video, we're going to talk a little bit about milk allergy, and we're going to break down the two different kinds of milk allergies. Plus, we'll cover the reasons why getting a formal diagnosis and not just trying to diagnose and treat it yourself as a parent is so important. My hope is that you're going to walk away from this feeling more informed and less anxious about the topic. So, milk allergy, or cow's milk protein allergy as we call it medically, can be really tricky because often the symptoms are subtle and easily mistaken for other common conditions of infancy, like colic or reflux. And on the one hand, many parents might worry that they are attributing fussiness or excessive crying or vomiting in their baby to normal baby behaviors, but only later to discover that there's an underlying allergy. But it's also true, on the other hand, that not every fussy baby has a milk allergy. So making that call can be a real challenge. The other difficulty is this. The symptoms of cow's milk protein allergy can vary wildly. Some babies have obvious and dramatic reactions, while others can display only mild signs that can be easily overlooked not only by parents, but by healthcare professionals too. Now, in broad terms, there are two main types of cow's milk protein allergy. IgE mediated, which we often refer to as immediate onset allergy, and non-IgE mediated, which we refer to as delayed onset cow's milk protein allergy. Immediate onset cow's milk allergies generally produce more overt symptoms that you might typically associate with a classical allergic reaction. So these can include hives, swelling of the face or lips, vomiting, and in some cases, by the way, extremely rarely, full-blown anaphylaxis. The key to this type of allergy is that the symptoms tend to appear shortly after exposure to milk, typically within minutes to a couple of hours. So the symptoms can be alarming, but in many ways they're often easier to spot and diagnose. A typical history for a patient might be that the first time the parents try giving the child formula, they develop a rash around their mouth within minutes and then vomit up the whole feed. This type of allergy can usually be tested for quite simply, using skin prick testing or blood tests. So there are often objective ways for doctors or healthcare professionals to determine whether this kind of allergy is present. The second kind of cow's milk allergy is a non-IgE mediated or delayed onset cow's milk allergy. And by contrast, these are trickier to pin down. The reactions can be delayed, taking several hours or even days to manifest, and they're more likely to involve subtler symptoms like diarrhea, constipation, reflux, flare-ups of eczema, or failure to gain weight. Now, these symptoms often develop more slowly and sometimes mirror other conditions, so parents and even healthcare professionals might not suspect an allergy right away. And it's harder to objectively diagnose because these types of allergy often don't show up on tests, and so a different diagnostic approach is needed. Often, an approach that involves carefully monitored exclusion diets, which means removing milk completely from the diet for a period of 4 weeks or more to see if the symptoms improve. So, why is it so important to get a proper diagnosis or proper professional support and not manage this yourself? Well, missing a diagnosis of cow's milk allergy can lead to a whole variety of different problems, including poor weight gain, poorly controlled eczema, skin problems, poor sleep, and even quite a lot of distress for the baby and the parents, especially if they aren't feeding well or are fussy or irritable. But on the other hand, jumping too quickly to the conclusion that a baby has a milk allergy can cause its own problems. Treating a baby for a cow's milk protein allergy involves complete removal of dairy from the diet, or sometimes for breastfed infants from the mother's diet. This is actually a huge undertaking, as cow's milk protein is present in many processed foods, so doing it properly requires a significant investment of time and energy and commitment. Plus, we don't want to expose the baby to unnecessary nutritional deficiencies or gaps if they never needed such an intervention in the first place. For that reason, I always encourage parents to discuss their baby's symptoms thoroughly with a healthcare professional, rather than relying on advice from online forums or trying to self-diagnose. The stakes here are high enough that it's worth having a careful evaluation, sometimes including allergy testing or a supervised trial removal of dairy in a structured way. And so, if your baby is exhibiting symptoms possibly consistent with milk allergy, it's important to explore that possibility with a professional so that your baby can receive a comprehensive evaluation, testing if needed, and guidance on managing their nutrition appropriately. And so, to summarize, firstly, milk allergy in babies can be challenging to diagnose because some cases are clear-cut while others are more subtle. Secondly, we broadly categorize cow's milk allergy into immediate and delayed onset, and both of those have distinct but sometimes overlapping sets of symptoms. Third, early and accurate detection is important because undiagnosed allergy can lead to discomfort and health problems for the baby. And fourth, misdiagnosing a milk allergy can result in unnecessary dietary restrictions, nutritional deficiencies, and stress for a baby. So, if you suspect your baby might be reacting to cow's milk, the first step is to seek professional guidance. And remember, of course, that the information in this video is meant as a general direction rather than a substitute for professional advice. If you have any other child health related questions or topics you want me to discuss, please write a comment below or upvote other people's comments so I can tailor the next few videos accordingly and make sure I'm giving you consistent value from this channel. Next week, we're discussing health checks. What are they, and should you consider having one? See you then.